Remember when your doctor knew your mother's maiden name and what your father died from? In 1960, the town doctor had delivered you, your children, and was planning to deliver your grandchildren. Today, urgent care clinics rotate staff so frequently you'll never see the same face twice, explaining your medical history to strangers who barely look up from computers. But that's not even the most dangerous part. Wait until you hear what we lost when healing became a corporate transaction. It was 2 a.m. on a winter night in 1960 when the phone rang at the doctor's house. He'd been the town's physician for 30 years, and that phone had rung at all hours for 3 decades. A mother called about her feverish child. He knew exactly which family, which child, and that this little one had suffered ear infections every winter since birth. Within 30 minutes, he was examining the boy in his home office, still wearing his bathrobe and slippers. The medical bag that traveled everywhere with him held what he needed. While checking ears, he asked about the grandmother's arthritis, the father's back injury from last harvest. He knew this family's entire medical story without checking files. Penicillin prescribed, instructions given, total charge, $5, payable when convenient. But here's what made the town doctor irreplaceable. He delivered most of the town's children. When women went into labor, they called his house. His wife would answer if he was already at another delivery, keeping track of where he was needed next. He'd arrive at homes with his delivery bag, transforming bedrooms into birthing rooms. He'd held these babies in their first moments, watched them grow, treated their childhood diseases, set their broken bones, and eventually delivered their babies. 3 generations of medical knowledge lived in his head. He recognized inherited conditions, family patterns, genetic predispositions without genetic tests. This wasn't just medical care. It was family history walking on 2 legs. His office occupied the first floor of his home. Waiting room with year-old magazines, examining room that smelled of antiseptic and pipe tobacco, small surgery for minor procedures. No receptionist blocking access, no phone trees, no 3-month waits. His presence in the community went beyond medicine. Friday nights found him at high school football games, ready to handle injuries. Broken bones, concussions, dislocated shoulders, he treated them all on sidelines. Saturday mornings meant rounds to shut-ins, elderly patients who couldn't travel. House calls weren't special services. They were routine expectations. He'd check on new mothers, follow up on pneumonia cases, adjust medications for chronic conditions. Sunday saw him in church, where parishioners mentioned concerns without making appointments. A stomach complaint mentioned after service meant stopping by Monday. Emergency? He'd open the office at midnight. Can't pay? Work out payments, trade services, or forget the bill entirely. The relationship transcended professional boundaries. When babies wouldn't come naturally, he stayed all night coaching mothers through difficult labors. When farm accidents severed fingers, he sewed them back on kitchen tables. When cancer struck, he sat with families explaining what would come, promising he'd be there until the end. And he was. The depth of knowledge was extraordinary. He knew which families had alcoholism problems, whose marriages were struggling, which teenagers were getting into trouble. This knowledge helped him treat whole persons, not just symptoms. Headaches that started when unemployment hit got treated differently than migraines. He prescribed medicine, but also wisdom. Understanding that teenage rebellion was normal because he'd raised children in the same town. Doctors who lived where they practiced understood life's patterns because they'd experienced them too. Death calls meant coming to homes, closing eyes, comforting widows, signing certificates. He'd been present for life's beginning and end, making him more than physician. He was witness to the human experience. Medical records lived in his head more than files. He remembered who reacted badly to penicillin, whose family had heart disease, which children were prone to strep throat. Then everything started changing. Fast forward to today. The town doctor is extinct, replaced by urgent care chains, corporate medical groups, and rotating hospitalists. Need care today? Drive to whichever franchise occupies the strip mall, sign in on a tablet, wait 2 hours despite advertised minimal wait time. Fill out the same forms completed last visit because systems don't communicate. Finally see a provider you've never met who types while you talk. Every visit requires explaining chronic conditions to strangers who won't be there next time. They ask about allergies already in the system they're staring at. Medications get recited repeatedly because nobody remembers. The 10-minute transaction follows corporate protocols: 7 minutes for simple issues, 10 for complex, 15 if lucky. The provider races through checkboxes, symptoms recorded, vitals entered, quick examination with cold efficiency. The corporate medical machine grinds impersonally. Prescriptions go electronically to pharmacies staffed by different strangers. Insurance might cover it, might not. Prior authorization needed? Another week of suffering while bureaucrats decide if relief is deserved. Medical records exist in a dozen different systems that don't communicate. Every specialist, every urgent care, every hospital maintains separate files. Patients become historians of their own health, carrying folders of records, repeating histories endlessly. Hospital care means hospitalists working shifts like factory workers. Day shift doesn't know what night shift decided. Weekend coverage brings new faces. Nobody knows names, histories, fears. Patients are room numbers, body parts, billing codes. Follow-up appointments scheduled months out. Sick today? Emergency room or urgent care, starting the stranger cycle again. Phone calls route to call centers in other states. Automated menus replace human connection. The human cost is staggering. Misdiagnoses multiply when nobody knows baselines. The town doctor noticed personality changes indicating illness. Strangers see difficult patients. Depression, dementia, and delirium get missed because providers lack context. Serious conditions get dismissed as anxiety by those who don't know the patient's normal demeanor. Minor issues get overtreated by those who don't know typical stoicism. Drug interactions increase when nobody tracks prescriptions across multiple systems. Elderly patients, used to one doctor managing everything, now navigate specialists who don't coordinate. Conflicting prescriptions, duplicate tests, dangerous gaps in care result. Trust evaporates. Why confide in strangers who won't be there next time? Why mention embarrassing symptoms to someone typing on a laptop? The healing relationship requiring vulnerability can't exist in 10-minute increments with rotating staff. Some doctors try maintaining old-fashioned practices. Concierge medicine promises personal care for those affording thousands in annual fees. Direct primary care attempts returning to relationship medicine. Some rural areas still have doctors who stay decades, but these are exceptions in a system designed for efficiency over effectiveness. Young doctors, burdened with massive educational debt, can't afford small-town practices. They join corporate groups, work shifts, move frequently chasing loan forgiveness. The economics allowing one doctor to serve a community for life no longer exist. Insurance reimbursements demand volume over value. See 40 patients daily or go bankrupt. No time for house calls, extended conversations, or knowing 3 generations. What we've really lost goes beyond nostalgia. We lost healthcare based on knowing the whole person. Pain might stem from recent loss, unemployment, family deployment. The town doctor knew because he lived alongside the community. We lost efficiency of consolidated knowledge. One mind holding entire histories, recognizing patterns, preventing problems. Fragmented care means repeated tests, missed connections, dangerous gaps. We lost comfort of familiar faces during vulnerability. Being sick is scary enough without explaining to strangers. The town doctor's familiar presence itself was therapeutic. We lost affordable, accessible care. When doctors knew finances, payment plans were personal. Now, medical debt destroys families navigating insurance bureaucracy. Most profoundly, we lost healers who saw medicine as calling, not career, who stayed with dying patients, celebrated births, grieved losses because they were neighbors, not just patients. The question facing American healthcare: can relationship-based medicine survive corporate healthcare? Can communities support practices prioritizing knowing patients over maximizing billing? Some try. They recruit medical students with loan forgiveness. They support practices taking time with patients. They value continuity over convenience. But swimming against the current exhausts even dedicated physicians. The system rewards volume, not value. It measures satisfaction scores, not health outcomes. It prioritizes efficiency over effectiveness. The town doctor represented more than medical provider. He was community memory, family counselor, public health guardian, and neighbor. His black bag carried not just instruments, but trust built over decades. Today's urgent care stranger, typing furiously while patients talk, can't provide what the town doctor offered: assurance that someone who knows you, your family, and your history is caring for you. That in vulnerability, you're seen as whole person, not billing opportunity. That your healer will be there next time, remembering what worked, what didn't, what matters. Somewhere, an elderly patient sits in another waiting room, preparing to explain their history again to another stranger who won't be there next time. They remember when healing meant relationship, not transaction. They remember the town doctor, and they grieve for grandchildren who will never know what they've lost.